Hello, and welcome to OSBT Standard Procedure 240, Bloodborne Pathogens Program Employee Education. Bloodborne Pathogen Program. One drop can kill you. Today we are going to discuss bloodborne pathogens. You'll be learning what they are, dangers, how they are transmitted, what our exposure plan is, and what to do if you're potentially exposed. Bloodborne pathogens, BBPs, bodily fluids such as pleural, cerebrospinal, precardinal, peroneal, synovial, and emetic, saliva and dental procedures, any bodily fluids visible contaminated with blood, any unfixed tissue or organ or other than intact skin from a human, living or dead, HIV or HBV containing cultural, cell tissue or organ, cultural medium, or other solutions, blood organs and tissues from animals infected with HIV, HBV, or BBPs. The hepatitis family. The most common types of viral hepatitis are A, B, and C. Signs of symptoms of hepatitis include enlargement of the liver, lymph nodes, and often the spleen, headaches, continuous fatigue, nausea, anorexia, abdominal pains, and sometimes mild fever. Hepatitis B is a virus that affects the liver. While initially causing inflammation of the liver, it can potentially lead to more serious conditions such as cirrhosis and liver cancer. HBV can survive in dried blood for up to 7 days, making it a significant concern for housekeepers, janitors, custodial personnel, laundry personnel whose contact with the dry blood may come outside an emergency or first aid situation. Its symptoms are similar to the flu, starting with a sense of mild fatigue and stomach pain. However, it may take up to 9 months before the symptoms become noticeable. Hepatitis B can be chronic and fatal. Even if it is diagnosed and you get help, there is a chance you'll never recover. About 6 to 10% of infected adults cannot clear the virus from their livers and develop chronic HBV. That is, they become HBV carriers for life. 25% of those carriers later will develop cryosis. There is no known cure for chronic HBV. One strain, flipped hepatitis, develops about 1 to 2% of cases, and is 85% fatal even with the most advanced medical care. There is a vaccine for HBV, which can minimize your chances of acquiring those diseases, which we'll discuss later. Hepatitis C. Like HBV, hepatitis C HCV is a virus that affects the liver. On average, 75% of patients with HCV infection later develop chronic hepatitis, cirrhosis, or liver cancer. Nearly 4 million Americans are infected with HCV, however, only 25% are diagnosed. HCV can be chronic and fatal. It is responsible for 8,000 to 10,000 deaths annually. Unlike HBV, there is no effective vaccine to prevent acquisition of HCV. HIV and AIDS. HIV, or human immunodeficiency virus, the catchall agent for AIDS, can be transmitted through needle sharing, needle stick, blood exposure, sexually, and prenatally. Most people who are infected with HIV will experience flu-like illnesses for 2 to 6 weeks post-infection with symptoms of fever, fatigue, and aches. If HIV is undetected and untreated, most persons will develop symptoms of AIDS, weight loss, diarrhea, fevers, infections, cancers for about 7 to 10 years. Types of exposure. There are 2 types of blood and bodily fluid exposure. Eucutaneous, exposure of the eyes, nose, or mouth as a result of splashes, sprays, or direct contact. Percutaneous, a break in the skin, a cut, a lesion, etc. Each exposure has different transmission routes and thus requires different prevention measures. Transmission of diseases. Organisms can enter the body by inhalation, air, ingestion, contaminated food or water, or direct blood contact, bloodborne. Reducing your risk, exposure controls, universal precautions, equipment, work practices, personal protective equipment, housekeeping, laundry handling, hazard communication labeling, and regulated waste. Universal precautions. Universal precautions is a method of infection control in which all human blood and certain bodily fluids are treated as if known to be infected with bloodborne pathogens. Universal precautions are to be observed in all situations where exposure to blood or potentially infectious materials is possible. This also means that certain engineering and work practice controls shall always be utilized in situations where exposure may occur. Exposure controls, engineering controls, eye wash stations, hand washing sinks, sharp containers, biohazard waste bags, pocket disposal, mouth to mouth resignation devices designed to isolate emergency personnel from direct contact with fluids. Exposure controls, safe work practice controls, are steps, procedures, or ways in which a job or task can be done more safely to minimize any exposure to blood or OPIM. Exposure controls, safe work practices. Don't eat, drink, smoke, apply cosmetics or lip balm, or handle contact lenses in any areas where there is a potential possibility for exposure to blood or other potentially infectious materials. Don't place food or drink in the refrigerators, freezers, shelves, cabinets, or on countertops or bench tops in any work areas. Exposure controls, safe work practices. Hand washing is one of the most important and easiest practices used to prevent transmission of bloodborne pathogens as well as bacteria. Hands or other exposed skin should be thoroughly washed as soon as possible following exposure to the incident. Use soft antibacterial soap if possible. If you are working in an area without access to such facilities, you may use an antiseptic cleaner in conjunction with clean cloth, paper towels, or antiseptic towelettes. Exposure controls, personal protective equipment. You must wear all required PPE. When equipment, safer devices, and safe work practices do not eliminate exposure, the use of personal protective equipment or PPE is required. PPE is the appropriate, will not permit blood or other OPIM to pass through, reach your clothes, skin, eyes, mouth, or other mucous membranes. Exposure controls, personal protective equipment, protective clothing, lab coat, gown, apron, surgical cap or hood, shoe cover or boot, fully encapsulated suit. Exposure controls, personal protective equipment, PPE, eye face, protection and masks, safety glasses with side shields, splash goggles, face shield, mask. Exposure controls, housekeeping, maintain a clean and sanitary workplace. Written cleaning and decontamination schedule and procedures. Approved disinfectant, bleach, EPA approved. Contaminated waste disposal methods. Laundry. Exposure controls, laundry. List of contaminated articles. Handle as little as possible. Bag containerized where used. Don't sort or rinse where used. Place in leak-proof, labeled, or color-coded container bags. Wear PPE when handling and or sorting gloves, gown. Exposure controls, communication of hazards. Must have the biohazard symbol. Labels attached securely to any container or items containing blood or other potentially infectious materials. Red bags containers may substitute for labels. Signs posted at entrance to specific work areas. Exposure controls, regulated waste. Liquid or semi-liquid blood or other potentially infectious materials. Contaminated items that would release blood or other potentially infectious materials in the liquid or semi-liquid state if compressed. Items caked with dry blood or other potentially infectious materials able of releasing these materials during handling. Contaminated sharps. Pathological and microbiological waste containing blood or other potentially infectious materials. Spill up cleanup procedures. Isolate the area. Do not allow unauthorized persons to enter the spill until the spill has been cleaned up. All surfaces to be cleaned must first be cleaned of all visible soil and blood before disinfectant is applied. Carefully remove visible blood with disposable towels by putting them over a spill to absorb it. Soak with disinfectant for a while if needed. Spill cleanup procedures. After cleaning up visible blood and soil, the area should be decontaminated a second time with the appropriate disinfectant used according to the manufacturer's directions. The area can have a final rinse, another disinfectation if needed. After cleaning up, materials, including PPE, should be placed in a disposable bag and double bagged. Hepatitis B vaccine. Employees who decline the vaccine must sign a declination form indicating that they were offered the vaccination but were refused. Vaccinations will be provided even if you have initially declined but later decide to accept the vaccination. Post-exposure evaluation. Provide immediate post-exposure medical evaluation and follow-up to exposed employee. At no cost, confidential, testing for HBV, HCV, and HIV. Preventive treatment when indicated. Test blood of source person if HBV, HCV, and HIV status is unknown. If possible, provide results to exposed employee. Exposure key element steps. Direct source individual to an emergency center. Provide the treating healthcare provider with an incident report documenting routes of exposure and how exposure occurred. Identify and document the source individual pending consent. Obtain consent and test source individual blood as soon as possible and document the source blood test results. Exposure key element steps. The source is known to be infectious for HBV or HIV testing does not need to be repeated. Provide the exposed employee with the test results and inform the applicable disclosure laws and regulations concerning the source identity and infectious status. Post-exposure evaluation, our company's responsibility. Provide exposed employee with a copy of Evaluating Healthcare Professionals, HCP, written opinion within 15 days of completion of evaluation. Provide the employee with information about laws on confidentiality for the source individual. Provide post-exposure treatment as needed, including counseling. Record keeping, training records. Dates, content summary, trainer name and qualifications, attendee's job and job titles. Maintained for 3 years. What is wrong or right with this picture? In this scene, a worker has just finished doing first aid on a coworker. She immediately cleaned up and disinfected the area contaminated by the injured worker's blood. The workers decide to get a snack from the vending machine. Is this the best place to remove contaminated PPE such as gloves? Shouldn't contaminated gloves be thrown into the garbage? It looks like the worker's shirt is contaminated. What should the worker do with this shirt? Should the worker do anything before eating food out of the vending machine? Is there anything strange about the biohazard bag? Is there anything wrong with her hair or shoes? Any questions? If you do, please contact your HSSC team. This concludes training for bloodborne pathogens. Please follow the link and take your quiz.